Dr. Daver, non-Hispanic Black and Hispanic patients with AML have higher mortality rates than non-Hispanic white patients, despite more favorable genetics in younger age. How can we address these disparities in AML among diverse patient populations?
This is a great question and something that I think we all need to spend more time in understanding. And now research has started to look at the differences in molecular profiles, cytogenetics, presentations among different ethnic backgrounds. It is definitely true that access to care has been more limited in some of these populations that you mentioned, including the Hispanic population and in the non-Hispanic Black population. And I think there are number of things that may be causing this issue. So I think one, there is definitely a economic divide, and especially for large academic centers where patients do have to travel, often stay locally for a period of time to go on the trial. You know, this causes expense, and a lot of times I think a number of these populations may not have that funding, or they may not have the insurance that would cover that particular center. And so this is one of the big hurdles. The second, I think that there is among these communities sometimes more suspicion or circumspect approach to clinical trials in large academic centers. And I think that's something that hopefully we will be able to change with programs such as this and many, many others that we all are working on. Because I think we actually do want to have more inclusion in clinical trials, and we do want to have a more representation of the entire population rather than just a subset. So hopefully the understanding that clinical trials are usually done with the intent to improve the current standard of care, and usually randomization includes the current standard of care, and then something that we think could be added to further improve that. And often that many of the clinical trials may even be able to provide some degree of financial support for travel, stay. These could all help maybe some of these populations to access and get on clinical trials, which is one of the big goals for MD Anderson and other large academic centers and investigators such as myself. I think the third big hurdle, of course, is that, you know, even for allogeneic stem cell transplant, which still remains the most effective long-term curative approach, we don't have as many donors for the Black and the Hispanic community proportionately than we do for the Caucasian white population. So I think this is another kind of call to voluntarily consider becoming a donor for the National Marrow Donor Program for others who are in that community, because we often do find challenges finding ideal donors. And this is a very simple procedure where if you're a donor, all you have to do is give a saliva swab, mail it in. You don't even have to go to the clinics nowadays. They log it in, and if you're ever called on, it's just a blood collection. It's like donating a unit of blood, and you could save somebody's life, literally. Probably the easiest thing to save somebody's life that you will have the opportunity to do in your life. So I think it's really, really important that those communities also start signing up and becoming voluntary donors. So I think these are three of the kind of hurdles. Of course, there are many, many others, but hopefully with the big push and impetus that's happening across the world and across the country and across the large academic centers in the next 5 to 10 years, we will see more inclusiveness and more representation of all populations proportionally in the ongoing trials and publications. My activation tip for this is understanding that clinical trials are usually developed to improve and move forward the standard of care to better outcomes, as well as knowing that there are many different approaches to getting financial support through different organizations, entities, and even potentially through some of the clinical trials, as well as considering becoming volunteer donors for National Marrow Donor Program, so you can support potential transplant for patients from those communities, which will give them a potential curative option.